Hello, everyone, and thank you for joining us for Chapter 1 of our four-part series on transforming healthcare into health creation. Today's presentation is titled Chapter 1, What is Health Creation? Presented by Jeremy Schubert, Divisional Vice President, USO Commercial Operations of Abbott Diagnostics, and Brian Clark, Director of Operations at GC LabTech. I'm Christy Jula-Flaberts, and I'll be your moderator for today's event. Today's educational web seminar is brought to you by LabRoots and sponsored by Abbott Diagnostics. For more information on our sponsor, please click on the Abbott logo at the left side of your screen. Now let's get started. I would like to remind everybody that today's event is interactive, and we encourage you to participate by submitting as many questions as you want at any time you want during the presentation. To do so, simply type them into the Ask a Question box and click Send. We will answer as many questions as we have time for at the end of the presentation. Now, if you have any trouble seeing or hearing the presentation, click on the Support tab down at the top right of your presentation window, or report your problem by using that Ask a Question box. Today's presentation is educational and thus offers continuing education credits. Please click on the Continuing Education Credits tab located at the top right of your presentation window and follow the process to obtain your credits. I would now like to introduce to you today's speakers. Jeremy Schubert, Divisional Vice President, USO Commercial Operations at Abbott Diagnostics, and also joining us today is Brian Clark, Director of Operations at GC LabTech. For complete biographies on our speakers, please visit the Biography tab at the top of your screen. Gentlemen, you may now begin your presentation.
Thanks, Christy. Ladies and gentlemen, this is Jeremy Schubert. As Christy said, I'm the Divisional Vice President for Core Lab Operations for Abbott Diagnostics. But I'm here today to present to you not as the leader of our Core Lab business, but I'm here to present to you today as a public health official, right? So to walk through really where the future of healthcare is headed, and to try to help us all understand, think about, and anticipate the role that we can play as individuals and as a lab community to contribute to the success of the evolution of our healthcare environment, to contribute to the wellness and well-being of our communities, and to contribute to the relevance of our profession. And so that's what we're going to talk about today. And it's going to be a bit of a pulp fiction story. And what I mean by that is I'm going to tell you a bunch of different dynamics that don't seem to coordinate or collate together. But in the end, I promise you it all come together in a nice, clean story with good, solid outcomes and direction for how we can proceed forward. And I always like to start this story with the story of Stephen Elop. And for those of you that don't know, Stephen was the CEO of Nokia. And I'm single-handedly keeping this man's personal pain alive because of what happened to Nokia. Now, several years ago, if you were walking around the globe, particularly if you were in Europe, you couldn't swing a dead cat and not hit a Nokia phone. Nokia was at the top of their game. As a business, there wasn't anyone that was even close, and they were supremely successful. And then all of a sudden, the dynamics changed on Nokia, and Nokia actually doesn't exist today. And in the very emotional press conference that Stephen had, he uttered what is perhaps the most profound business statement since the 2000s began, which is, we didn't do anything wrong, but somehow we lost. And I think it's important for all of us to really digest that statement because, for us, as we look forward into healthcare and we look forward to building the relevance of the lab, it's not about not doing anything wrong. It's about making sure we understand what's the right next thing. What's the right evolution we need to take? What's the right change we need to make? How do we actually tweak who we are and what we do and how we do it to create everlasting and incremental value? And that's a challenge for us all. And so as we start this conversation, it's about really putting ourselves on a footing so that we can anticipate what that looks like, sounds like, and is like. Now, this story actually has to start of us wheeling way back to 2013. And the interesting part about this, and maybe surprising to many on the phone, was back then medical error was the third leading cause of death in the United States. Now, if you think about that, that's pretty shocking. But if you're in healthcare, in the depths of healthcare, you understand that's probably not wrong. And so given that, it was a signal to our U.S. healthcare system that we could do better. And although it's not the fundamental catalyst, it was one of the catalysts that drove us to rethink what does value-based care look like in the U.S. This information actually triggered a chain of events that brought us a new quality definition for healthcare. And in this quality definition, it starts to expand out to the outcomes. So although it's still a fee-for-service type of economic environment, there was a lot more interest and energy and focus put on the outcomes that the healthcare system was meant to deliver. And so a ton of assessment that's going around to think about, hey, Mr. Health System, this is what we expect from you, and there's going to be a financial incentives or penalties for you not achieving that. So there's economic value that's recognized by rethinking what quality is from a healthcare perspective. Now, why I share this with you is what you don't see up here are lab metrics. You don't see turnaround time. You don't see cost per test. You don't see specificity and sensitivity of assays. And it's not that those things don't matter. A high-quality lab, CAP accredited, that counts, right? But that's table stakes. And so for us to be relevant in the healthcare arena, what we have to think about and challenge ourselves to think about is how do we actually improve the CMS metrics? How do we participate and actually are active and recognized for moving the needle against these quality domains that exist? And so our story kind of starts there of thinking about what are the metrics beyond the lab that we need to understand and that we need to have a meaningful plan for and active participation in for us to be able to drive. And this is all a fancy way of saying that the future of the lab is not going to be identified by automation alone. I work for a company that has automation, and for sure automation is important, but automation isn't the central theme of what the lab needs to be. In the future, thinking about this concept of the metrics that our health systems are being embodied by and what the future metrics are going to be, the definition of the lab and the primary responsibility of the lab is to improve the decision-making that happens across not just a patient pathway, but across the life course of an individual. Right? Because it's these decisions, good or bad, that modify the cost and the quality of care that people receive. There's a great old axiom that 80% of the cost cascades off the tip of a physician's pen, and that's just a fancy way of saying the decisions that they make, that our physicians and clinicians make, are what's going to drive cost and quality. And the lab actually is not, we didn't go to school to learn to pipette by mouth, and we're not in the lab because we're the best pipetters in the class. We're in there because our entire discipline is centered around being able to take data and convert it into insight that improves the decision making. We're actually at the cold face of what drives cost and quality, and we've got to reimagine ourselves to be actually taking responsibility in interaction with how these decisions get made, both within the health system and in the normal life course of the individual. So what I'm going to do now is walk a little bit about how healthcare is going to change. So I'm shifting gears a bit. And historically, health systems have been designed around this concept of physical well-being. It wasn't until the 90s that mental health became part of the normal vernacular and really featured more heavily. And it hasn't been until recently that mental health has lost some of its stigma. But that's actually not the core definition of health, because the human has got multiple domains and dimensions that we care about. There's social health. There's emotional health. There's spiritual health, right? And this is a fancy way of saying we all want to be treated holistically, not just for our physical condition. And the concept we have is, who on this call wants to be physically fit but emotionally poor? And if you're having a hard time answering that for yourself, what would you want for your kids? Now, why I share this with you is because the way our culture is evolving is the next level of generations are going to want to be treated holistically. And so we have to understand that how are we going to participate in a world where this holistic element is important. Now, to kind of juxtapose that against something, I'll give kind of a quick history lesson of health, because most health systems were designed around this concept of acute care, where we get sick, we go in, we get better, we leave. It was around 2010, although for many decades this chronic care element had been in the vernacular or in the research, it wasn't until around 2010 till this chronic care revolution started to take off, where people started to realize and talk so much about how we have an aging population, we have more chronic disease, and how that's going to impact healthcare, and how people started to try to reshape around how do I build a delivery system for my chronic conditions. And again, although it's been around for a long while in terms of social research and in the literature, it wasn't until actually 2014, 2015 that prevention really started to take off in terms of how healthcare systems were trying to reshape. And really thinking about, okay, if I can prevent some of these conditions from happening, then I can have a much better, much more effective health system. And for those that are in the public health arena, you understand this as what we've all known all along, is that it's insufficient to look through any one of these lenses, right? And to build a system that's designed against any one of these lenses, what we have to be able to consider is how do we take care of can participate in the entire life course of an individual, right? And understanding how do you design a system in such a way where each individual can optimize their life course against these concepts or broader concepts of health. And so what it brings us to kind of the point of where health care has to evolve, because we're no longer talking about health care. None of us are in that business anymore. That business is a dinosaur that does not exist anymore. We're all in the health creation business. And so we have to shift gears, our thinking, our processes, our models, in such a way where we can participate in a value-creating manner in health creation. Not only health creation for individuals, but health creation for our communities and health creation for our systems at large. And so health creation kind of becomes the core end. And so this is kind of one dynamic of it's a different endpoint and a much broader way of thinking that opens up the possibilities to create a ton of economic and clinical value. Now, kind of taking that one step further, many of you might be familiar with the social determinants of health. Starting around 2018, this became, again, something that started to surface more heavily in the U.S. Than even globally around social determinants and the impact that they have on healthcare. Again, social determinants have been around for a long while. Whitehead's papers were published in the 90s, so there's a ton of runway to this. But it hasn't been until recently that we're starting to wake up to recognize, hey, as a health systems, we got to deal with this. Now, for those of you that are not familiar with the concept is simply that 10% of your health is derived from the health care that you receive. There's so many other social factors that come into play here. Some that are obvious, like do you smoke? Do you live in a poverty area? Some that might be really latent and hard to tease out, like was your father a blue-collar worker? Do you come from a mixed family? So there's a ton of these other things that come into play that do affect the overall well-being of the person. And why this is important as we start to take it even one step further is we can learn more about a person's condition and their health from their zip code than their genetic code. And that's a very provocative statement because if you think about where is all of our investment in lab medicine going, where's the cool new sexy technology? It sits in this concept of the omics, right? Where we're trying to understand and sequence genes and do all the genetic testing. And the reality of life is there's a wealth of information that might give us better insight to that human, to that person, from their zip code. And it's about being able to now think a little bit bigger about how do we use that information to facilitate better productivity, efficiency, and effectiveness of the system to provide that overall care. The bottom quadrant you see to the bottom right is, although it's difficult to read, is it gives you a flavor of the light blue bar is the spending that every country has on healthcare, and the dark blue bar is the spending that they have on social services, right? So handling these social determinants, if you will. And although it is a truism that the U.S. spends more per capita on health care, that light blue bar, that spike that you see, and it is a truism we spend less on social care. When you blend the two, we're kind of somewhere in the middle. And I don't share this with you from a political statement that says, hey, from a U.S. perspective, we should spend more on social care. That's not the point. Even if we flipped our entire model and doubled that investment, it might be a decade before we got to see the real benefits of it in overall cost and quality of life. However, what it is to say is if we're in the healthcare system as we know it today, it's just a call to attention that we're going to have to deal with the social determinant factors through the healthcare system. There's not sufficient services and existing infrastructure and otherwise to handle them any other way. And so we have to have awareness that we got to build systems that are capable of compensating for maybe a lack of the social determinants or in general, no other mechanism for us to solve through them. So that's just more that. Now, as it relates to kind of some other factors to consider as we think about the future of healthcare, you know, we talk a lot about personalization, personalized care, personalized medicine, but the real word that we should focus on is engagement. Is how do we engage with a person? Because we can personalize a plan to any single individual. I myself have had a number of personalized diets that people have given me that are personalized for me. That's not stopping me from eating donuts. Unless I engage with the diet versus the donuts, I'm not going to have a better outcome. And so for all of this, it's just to say we have to have this sense about how do we create engagement and interaction with the people that we're trying to serve. In addition to that, we have to understand that people want their health care integrated into their day-to-day life. It's insufficient to have the health system be defined as four walls of brick and mortar. The people want to experience that in their day-to-day life, and they will. The dynamics will change to enable people to do that. And let me give you the kind of core example of this is, you know, today, you know, there are smart toilets that can do a ton of diagnostic type testing. There are mirrors that can tell if you're anemic, if you're upset, if you haven't slept. Many of you have a smart watch and a smart bed that can tell you how long you slept, how many times you stirred, how many breaths you took, how many heartbeats you had, a ton of information. But as you move that further, there are smart fridges that can tell you how many calories you withdrew and what type of food that you're eating. Siri can tell if you're upset, or Alexa can tell if you're sad or you've been working late. It's not unrealistic to consider a world where you walk into the morning after your morning routine to get a cup of coffee and for your refrigerator to tell you to put the donuts back in the fridge and take out the tofu, and for Alexa to come over and say, hey, I noticed you've been working late, you're not sleeping, you sound really depressed, I've ordered you some Prozac, the drone just dropped it off on the front porch, I sent a Roomba to pick it up. So this is not an unrealistic outcome. And so why I share that story with you is the location of care, the location of diagnostics, the engines that may drive that direction of care may not be and probably won't be the traditional lens that we look at. So in that world, we have to be preparing for how do we participate and continue to create value to do that. Now, a couple of interesting barriers and opportunities. All ecosystems have these three primary components. The health system as we know it today, the community resources, whether that be food pantries, social services, a ton of other things, and then home, which I would say is just your general life course day-to-day work. The challenge that we have in most health systems or in most communities is these things are not connected at all. They're not connected at all, and what we want is a world where there's a connectivity across all of these things. So it really is fully integrated into a person's life, but that they do have access to health resources, health system resources that are beneficial, but that those can be coordinated with community resources that are beneficial, and those can be integrated into the day-to-day life course of the individual. That being said, we want to think about the end game of this is healthcare is like Wi-Fi. It's not defined, health creation is like Wi-Fi. It's not defined by borders and brick and mortar. It's kind of integrated and surrounding a population. And this is effectively where it's headed. Now, the challenge and the opportunity exists in one simple thing is because it's not that all of these capabilities, these resources don't exist. In fact, we actually have sufficient amount of resources to create a ton of healthy living for people, a ton of quality life years for people. However, the challenge is that these entities can't communicate, data can't move, and therefore it can't be used as effectively as it needs to be. These bridges between external data into the health system, even bridges about moving data to the right places in health systems, bridges out to the community, to the home, they're not viable today. However, right, what we have to think about is it's important for us to be thinking about a world where these bridges exist and how would we participate. And in as many cases, from a lab perspective, we may need to take the responsibility to build those bridges on our own and using various technologies that can help us get started. Some additional backdrop to that in the interest of time is the fact that most health systems are hitting some very tough economic times. Right? Most are on a glide path to minus 4% net income, which is just a fancy way of saying of not being able to make payroll and shutting down. And this is a real problem and a real challenge that the executives of health systems are facing. This is why they get enticed to outsource and to take a big check from one of the big reference labs to outsource their lab, because from an economics perspective, it gives them some short-run relief over short-run pain. So there's an economic driver to this that is really, really important for all of us to consider if we're going to think about the future role we have. Because from a laboratory perspective, it's not enough to say we generate 75% of the clinical information that's used in diagnosis, whether you believe that fact or not, because it really doesn't matter, because 100% of orange juice comes from oranges, but that doesn't mean oranges aren't a commodity. So we really have to think about and challenge ourselves at how we're going to participate in creating new value. Now, what you might not know, right, is today the lab is usually the second or third best, highest contributor to the profitability of a healthcare system. So even ones that are on this glide path to -3, the lab is the one thing that's probably profitable for them. It's the one thing that is making the money. Now, because of how accounting is done in healthcare, this is invisible to most executives. You may think your executive knows this, they do not. It is not that clear to them that actually the lab is generating a ton of activity-based value to their health system. And if you wanted to see this information for your individual site on the left, if you let an Abbott person know, they can pull this information for you and give it to you. The thing I want to highlight, though, as we move to the future is that if you think about it from a health system executive perspective, the person who's having to navigate this -3%, and they want to do it through a combination of growth and cost containment, the primary swim lanes that they would look at, that you see on the right-hand side of the slide, are all things the lab can impact. It's not a stretch to believe the lab can impact somebody's net income by 5 to 7% by just reimagining what it does today. Not by retooling with $70 million of automation, by rethinking its processes, retooling with a little bit of informatics support, but can actively and dynamically contribute to recovery of the health systems that are on the glide path. They can move them to profitability, and that profitability is a concept of no margin, no mission. So being able to continue the mission and continue to evolve and continue to have the capital available to reshape the health system. The lab is the savior. And today it's treated as a cost center to be outsourced when it's actually probably the one department that can release a ton of this pressure from a financial perspective and create a ton of value from a clinical perspective. And that being said, it leads to us to just there are 5 business principles that we could run through. And I'm not going to run through all these. You can see them on the screen. But I'll hit them at the end. But 5 core things that any lab should be considering building on so that they're in the best position to facilitate helping their health system. And I'll come back to these at the end. For now, I want to turn it over to Brian, and Brian's going to walk us through what he's doing in his laboratory given this dynamics of change and how he's taking steps forward to reimagine what his system is and how they create value and what that value is. Brian?
Thank you, Jeremy. I appreciate it. Looking forward to discussing how GC LabTech has implemented certain solutions to help ease some of these items you just mentioned. Stand by, let me get my slides ready to go. With that, I'd like to introduce GC LabTech. This is a company that most people have probably never heard of because we were incorporated as recently as 2016 as an international subsidiary of GC Pharma out of South Korea. What we do here at GC LabTech is we exclusively perform laboratory testing on source plasma donations, meaning we only test the required tests from plasma donors whose plasma is going for further manufacturing. So that does not mean we are testing whole blood donations or anything like that. It's strictly source plasma donations in which that plasma will then be made into vaccines, protein solutions, etc. We perform the testing on that, and with that, in our very short operating history, we actually stood up GC LabTech within just a little over a year for us to activate the company and get everything ready. And during that time, since then, we've also become CAP accredited. We've had successful FDA inspections, and we've also been inspected and approved by the Korean Ministry of Food and Drug Safety, which is South Korea's equivalent of the Food and Drug Administration. And along with that, we've had a variety of supplier qualification audits performed, all very successfully. And why does that matter? Because one of the key things that has been one of the shining stars for our process has been an inventory management system. And so with that is what I will be going into with this. Just a brief background on myself. I was the very first employee within our company, and I was selected to lead the creation of a new lab testing source plasma donors. Our enterprise chose to make versus buy, meaning we chose to make our own laboratory service rather than continue to contract it out. Once an organization reaches a level of performance, that decision can become a business decision as to what you want to do. Do you want to continue sending that out as a contract service, or do you want to control it within house? And the decision was made, and therefore I was contacted to build this company, and with that, used my experience of being a retired laboratory officer from the U.S. Air Force. And also prior to that, I've been in the whole blood industry at the South Texas Blood and Tissue Center, and also with the clinical side with Baptist Health System San Antonio for a brief stint. So just like each of you, as I looked at our audience, most of you are coming from a clinical setting. Our lab faced the same challenges that you face. And what were those challenges? Well, we were created entirely from concept. What does that mean? Whenever I joined, our layout was pretty much drawn up on a bar napkin. And that's a cliche, and it sounds funny, but it's really true. When I first had my first discussion as to building GCLT, we seriously met at a hotel bar and had a discussion and kind of drew out what we were expecting. And with that, we started without any infrastructure. We had nothing to replicate. I know many of you have expanded your own labs or joined an organization that has done that. And typically, you have SOPs already established within a system. You have a facilities team. You have a variety of resources at your ability to use. However, with GC LabTech, we had nothing. We had myself and our CEO at the time, and that was it. So we had to create everything from real estate searches to proper suitability, placing the organization within the right city location, working with coding, and all of those necessary items to make sure that we were operating not only within business compliance, but also we had to establish what instruments we were going to use. We're doing donor testing. Even though it's source plasma donor testing, we still had to work within the confines of what was approved by the US-FDA. We had to establish supply contracts, all of the negotiations associated with that. And then to build upon that, one person can't do it all, so I had to build a team of staffing. And that also included taking care of all of our regulatory filings and all the necessary steps to ensure we were performing within compliance. Along the way, we did choose to partner with Abbott. When we did instrument evaluations, we learned about some of the resources that Abbott had available for a laboratory. And one of the things that brought us to Abbott was the ability for the Allen IQ inventory management system and what it would do. Because here's the thing. No matter what type of lab you run, whether you run a clinical lab in which you're performing diagnostic testing for patient care, whether you're doing a tox lab, whatever type of lab you're doing, even if you're doing a veterinary lab, what's one of the key things we all have in common, and that is inventory. It doesn't matter how many staff you have. It does not matter how many locations you have. In order to run a successful laboratory, everyone is going to need inventory. And so most places have been very successful at the tried and true method of paper management of inventory. However, when we learned of the ability to have an automated supply management system, we were intrigued, because as we go through the slides a little bit, in my laboratory, total staffing, we currently have about 12 employees for a company performing hundreds of thousands of donor testing each year. So we only have a dozen employees, and more than half of that is administrative and quality assurance staff. On that note, as you can see, Jeremy did speak to a number of things of how healthcare is being shaped and shifted into the future. Well, this is one of those realities which is actually available to us right now. We were able to use the IMS system for a variety of reasons. With our inventory, even though we don't have many Abbott instruments, we were able to use it to tag our inventory, and we were able to do that with non-Abbott products. We're able to have immediate inventory snapshots as to how much inventory we have on hand. We can trigger it to when we need to order supplies based on lead times, and it helps us manage everything in order for us to manage this. Because, excuse me, one of the things that also helped us with this decision is by us being able to monitor this workload, because we were unable to bring in a bunch of staff because we wanted to use automation at our fingertips, and we knew that we had gaps. We wanted to not hire a bunch of extra staff to manage things that could be automated. And with that, what we wanted to do was even get to a point where we could use that decision, those decisions to shape our business without having to bring in extra staffing in order to manage that. So how has Abbott helped us address these challenges? Well, here's the thing, is that with this inventory management system, as I spoke about, everybody has inventory, no matter what it is, and we were no exception. Our lab is very heavily automated, meaning that our instrumentation does the work for us. We have pre- and post-analytic devices. We have instrumentation that takes care of all the testing. We have very few touch points in our lab, and therefore, with that level of automation, there was no sense in us trying to manage a paper system of inventory management, and therefore we considered and implemented the inventory management system. We're able to easily tag other vendors' products in our catalog. It has been heavily evaluated with our CAP accreditation and also with our FDA inspections that we've had, and even our supplier qualification audits, in which many of them were exposed to this system for the first time, and it was one of the best practices, several different audits that we had, just because of the fact that we were incorporating new technology and making changes rather than just talking about changes. We actually had implemented it, and it was very simple to do. So on that note, what we expect with the Allen IQ and Abbott moving forward. We're moving into an integrated platform in which the entire system will not only touch our inventory management system, it will actually touch all of our instrument platforms and be able to help us monitor our business, make crucial decisions about how we're moving forward, what to improve upon, not just from a metric standpoint, but from a granular level of how much are we spending per test. You know, how much are we really doing in a cost per test environment? This system will allow us to get to that granular of level with staffing hours, from the ability to find out how much we're truly inventory, how much we're bringing in inventory, how much we're actually using. We don't want to have too little inventory, and we don't also want to have too much on the shelf being locked up with unavailable costs to be able to make use of. So another item that is really great is that with this level of in-depth analysis, we're going to be able to really make some good decisions, and we could potentially benefit our clients by adjusting pricing in a more accurate setting rather than just an educated guess. And so on this note, I'd like to share a little bit of our daily experience with the IMS system. I would like to preface the video that this was taken within our laboratory, and as most of you know, laboratories are loud. There's refrigerators, there's freezers running, instrumentation running, so the normal hum of a lab is present in our video. However, I would like to just share a few minutes of how we're using this system to make our lives easier, because again, it's really important to understand that no matter what type of lab you're running, you have to handle inventory and you have to be able to do it easily. And if you remember, I only have a few staff members available, and therefore this system is taking the place of many, many staff members. And with the touch of a few scans and at our fingertips, we have ultimate control over our entire laboratory's inventory. So with that, I would like to turn it over to the video, and please enjoy.
Hello everybody, welcome to GC LabTech. Let's take a look inside as we get ready to show you how the IMS system is utilized within our lab, and we look forward to showcasing this. One of the most common questions we get with the Abbott IMS system is being able to tag non-Abbott products. Our lab uses primarily non-Abbott products, therefore this allows us the opportunity to tag these items and use them in our inventory system without having to worry about pre-tagging. So with that, I'm going to turn it over to Chris, our laboratory supervisor, as he gets ready to tag a non-Abbott product.
In order to log in non-Abbott items, you simply go to manual item creation, find the item needing to be logged in, tell the system we're creating an item for the product, enter the quantity, the lot number, and expiration date. Once we've done that, we can print the RFID labels . Tag the items and take them to our receiving area. This automatically places the items into our inventory. Any items such as controls, kits, or any other items needing qualifications prior to use are automatically placed into the digital routine.
So as you can see, in just a few minutes, very easy to add in non-Abbott products into our system.
Another convenient feature of the Abbott IMS system is the ability to pull pre-existing reports and also custom crystal reports. We use the system quite extensively to monitor our supply levels, our expiration dates, make sure we're following accreditation standards and also regulatory requirements. But the ability to have at your fingertips information as to what our inventory status is helps prevent shortages. It also helps prevent immediate shipping requirements to get product to us. We just have a good visual on everything inventory related. And with that, we probably use most commonly just an overall inventory check. We also use various reports to monitor our usage rates and also how quickly we're going through supplies. And we can even gauge the lead time that it takes sometimes for products to come in. And so with that, this has been an invaluable asset with the Abbott IMS system, the ability to have at your fingertips such a powerful system. Another frequently asked question that we get at GC LabTech is how easy was it to implement the Abbott IMS system? With that, Chris will describe the implementation process. Chris?
Implementing the Abbott IMS system was quite easy. We had help from the Abbott team throughout the whole process. Building the catalog was quite simple with the template that they sent. The most extensive portion of the process was actually tagging and cataloging all the supplies into the system. After that, the system has been extremely easy to use and has saved us hundreds of man-hours of time in receiving, inventorying, and keeping up our system.
So like with any project, it's easy to see that some investment will be needed at the front of the project. However, the end result is invaluable. It's been a system that has worked very well for us and would not look forward to returning to the paper system of inventory management in any way. So just consider it an investment. The time up front is well worth it in the end. In closing, the Abbott IMS system has been a real game changer for our laboratory. We've been able to comply with all regulatory accreditation standards with ease. It's been a very good system. We have had zero instances of having to emergency or urgent ship product or supplies to us for use because we've been able to manage that inventory successfully. Also, our team has not used any expired reagents accidentally because of the digital quarantine, allowing us control over those items far greater than the human touch. Another item is working in the laboratory for over 20 years. This is a brand new way to do inventory and laboratory management and any other type of management. It doesn't necessarily have to be a laboratory. It can be almost any product or service that you're trying to manage in inventory. The controls are at your fingertips, and I'm very grateful for Abbott to have such a product available at an affordable rate.
Thanks, Brian, for that presentation. And to be honest with you, I don't know how you got George Clooney and Brad Pitt to do the video for you guys, but they did a fantastic job, definitely an Oscar-worthy performance. So, yeah, if you could introduce me, that would be awesome. For my friends on the phone that are still with us, just to kind of conclude, tying these things out, as we think about, we talked about 5 steps that, the lab should be considering working their way through to ensure that they're in a position to contribute in this new world. And what Brian just shared with you, even though it's inventory management kind of a concept, it's about finding these hidden costs and these hidden inefficiencies that free time to enable all of us to focus and put our eyes outside the 4 walls of the lab. Anything that can enable us to move our eyes to some more of a value-creating activity, the better off for us. And so, not to belabor these things, but they're about challenging ourselves to have a different business process, expanding our business model beyond moving towards just processing results and giving numbers, for our business model to actually step into and integrate with clinicians and help them make those clinical decisions, help them understand the options that are available to them from a pathway perspective, even being in a position to recommend how that plays out, or stepping into the physicians that we're serving in the community and helping with their quality metrics and how they're driving their business and how they're serving their patients, to maybe even reimagining some of the services that you provide to payers or to the people that derive healthcare from your system, whether that be different reports or information that facilitates helping people be healthy, be their best selves, live their best lives. Establishing adaptive operations is also really essential, and this is where a lot of what Brian was talking about and a number of things can fit in. Oftentimes when we go out for RFP or we're trying to retool our lab, we do that maybe once every 7 to 8 years. But by the time that system gets on the ground, if we think about it only from an automation, instrumentation perspective, and even initial informatics architecture, it's already outdated before it actually gets up and running. And the central theme here is, how do you build a lab operation that's adaptive, right? That's designed in such a way where you can scale up, scale down, scale out, scale sideways, where you can consistently build and think about using data differently to optimize what you're doing to care for your health system and care for the people that you're serving. Obviously, integrating the clinical care is an important step, as well as building back to this concept of this health creation competency. And I want to talk about that concept of competency a little bit, because across the board, competency is something different than skills or knowledge or data. Competency is transferable, if you will. It's more than just it's about building a bunch of related activities that are transferable across. We think an example we might have is we have utilization management, right? So we all are asked as laboratories to reduce the amount of testing that we have, and we may focus in with a few reports on cutting out redundant glucose testing or unnecessary CBCs. Or the random PSA that might gets ordered on a woman. But the reality of life is utilization is a competency that transcends lab testing. And so it's about thinking about how do you create optimal stewardship across the continuum. What are the principles? What's the thinking? What are the behaviors? What are the systems? What are the processes that need to be put into play that facilitate ensuring we've got optimal utilization of the precious resources that we have? Yes, utilization can be an activity. Yes, it can be a report. Yes, it can be a program. But at its highest order, it's a competency. It's a way of thinking. It's a way of living. It's a way of operating the business. And so if we kind of summarize this down into some things that we can and should consider to be able to move forward from a laboratory perspective, we shared these 5 steps. We've talked about competencies. The best thing you can do as a starting point for this is do a deep dive assessment of your own lab, right? A really critical look at evaluating, if you even just start with the diagnostic cycle, evaluating, how well that's getting executed and identifying where are these opportunities to create incremental value and where are maybe some things that we're doing today that are actually creating inefficiency or waste outside the lab. We have a system that can do that you can use if you're interested in having somebody help you with an assessment. We have a tool that you can be used to help you do that. By the same token, and then it moves into going through a systemized approach for how do you build a strategy, right? Because you can have a strategy in your head, but that's pretty much useless. What you need is a really written plan that then is converted to some sort of balanced scorecard that's converted to some sort of business process that helps you manage it. And again, the encouragement here is take the time with your staff to build a very meaningful strategy that aligns to the strategy of the enterprise, that enables you to clearly speak to the C-suite about what you're doing and how what you're doing is contributing to the success and achievement of not only the goals, but of the metrics that are associated with their health system and what they deem to be important. If you can't align what you're doing day to day in the lab to what's day-to-day important to the CEO, you're not going to be relevant to the CEO. And so we have a process that enables you to do this, but if you don't want to have help from ours, use some process that enables you to get to a written strategy, a written balanced scorecard, and a modality or business process of being able to consistently communicate to the C-suite the value that you're creating. I'll end on a personal story that I was asked to share because it's relevant to tying all of this off, and the importance that each of you have in transforming the healthcare system. Because I firmly believe in the power of the lab. Several years ago, when I decided to go back to get my master's in public health, which no one does, because you don't do that for the money, and for sure there's nothing cool about it. So when you go back to study public health, you got to have a really detailed, passionate reason why. I went back because I wanted to ensure that I was able to participate in whatever part of healthcare was going to be the catalyst for saving it, for creating change, for creating value. I thought that was somewhere besides the lab. And after all the study and all the papers and all the projects and everything that you learn going through that process, I came to one central conclusion. There's no better discipline to be a part of if you want to change healthcare than the lab. But I have to caveat that with two words: for now. Right now, we have, as laboratorians, as laboratory medicine professionals, we have an excellent opportunity to be the catalyst for a ton of value creation. We can change the face of our health systems by using our data to anticipate what's happening with disease burden, with population shifts, and we can inform our health system of what their strategy should be. We have the ability to improve the decisions that clinicians are making by being able to leverage our data and step into the clinical pathway in an automated, semi-automated, or direct way to facilitate these better decisions that they're making. And we have the capability, and it's the only discipline in a world where people's health and health care are going to be derived from the home. It's the only discipline that can participate there. And so it's the bridge that can keep health systems relevant in their communities. And it's important for now. But we have to change. We have to step in. We have to have a different business model. We have to have a strategy. We have to understand the opportunities for creating value for our health systems and our communities. We have to have measures for that. We have to have the tools that enable us to participate in that, and we have to insist upon it. No one's going to bring it to us. We have to insist upon that change in our health system because that's what's going to make us relevant for the future. And with that, my friends, I want to thank you for your time, and we're going to turn it over to Christy for any questions or comments that anyone might have.
Thank you, Jeremy, and thank you, Brian, for your informative presentation. We will now start the live Q&A portion of our webinar. Now, to our audience, if any of you have any questions you would like to ask, please do so now. Just click on that Ask a Question box located on the far left of your screen, and we will answer as many questions as we have time for. Okay, let's get started. We have some great questions already coming in. Now, Brian, let's start with you. Can we scan the packaging barcode to build non-Abbott inventory instead of manually typing in the information?
Hi, Christy. Thank you for the question. To address that, yes, it is an option that we did explore. We chose the typing option just for some of the accuracy because sometimes it's just, for us, it was easier to do it that way. However, upon the implementation strategy, this could all be worked out with your Abbott engineers when they bring it in, and you can get through with that if you so choose. But regardless of whether it's typing or scanning, either option is very easy to do. As you saw within the video, that took a matter of seconds, really, and it's just really simple for us to do. So the scanning option wasn't necessarily something that we considered. So hopefully that helps answer your question.
Thank you, Brian. Let's go with this question for you as well. how many man hours has the inventory solution saved for your staff? And have you utilized that time any differently?
Yes, another great question. So with that, if you think about, we brought this system in relatively soon within our organization's creation. So we were able to, rather than calculate the number of hours saved, we were actually able to use it in the sense that number of positions saved, because many of you in your laboratories probably are having several folks manage your inventory, meaning that, you know, depending on the size of your facility, most clinical labs have everything broken out into sections where the core lab or the hematology, the chemistry, the microbiology area, the blood bank, all kind of have different supply, you know, managers, if you will, or additional duties. For us, what I would say is that this allowed us to not have to worry about hiring more people to not only do plasma testing, but also manage inventory and so forth. We were able to keep our costs very, very minimal in comparison to what it would take to hire an additional employee or pay an employee, because in the laboratory, what's one of the main things that generates revenue? It's techs performing testing and turning out results. And if they're not turning out results, unfortunately, they're not necessarily generating revenue. So therefore, if you look at it, this allows the techs to go back to the bench, perform the testing, improve the turnaround times, manage the inventory, and then as far as utilizing that time differently, I would say from a managerial standpoint, it relieved a lot of worry. And what that means is that I do not have to worry about my staff using expired reagents. I do not have to worry about my staff having an urgent supply order that has to be overnight shipped to us. And for those of you who have that worry, it's expensive. It's expensive emotionally, it's expensive economically, and in order to utilize that time differently, I now have in my lab a system that prevents me from having to have that worry. So for me, it's a overall, you know, holistic approach to utilizing time differently, because I don't have to worry about many things that I once upon a time had to worry about.
Thank you, Brian. Now, it looks like we have time for a few more questions, but I do want to remind our audience that those questions we are unable to answer live today, and those that are submitted during the on-demand period will be addressed via the email information you provided at the time of registration. Okay, Jeremy, let's come over to you. Now, the lab's perception within the health system is typically as a cost center, even though there is a lot of untapped value. How can Abbott help change this perception?
Yeah, it's a good question. And for those of you that don't know, I'm from Texas, and we use kind of a Texas analogy here is, you know, the laboratory medicine, and as a discipline, it'd be analogous to you have this big patch of earth, right, that's sitting on top of 100 years of oil reserves, and you're choosing to farm cotton on it. And for those of you that don't have a farming background, that's absolutely the worst thing you can do with the earth for the earth is to farm cotton. And you've got all this natural resource that sits here, and it's unfortunate because what most executives see is a cotton farm, right? A production facility that's pushing out, you know, numbers on a daily basis. And that's why I said where I ended the presentation, you know, a first step in that process that we can help with is spending time working the assessment, really looking and zeroing in on the diagnostic cycle initially to identify where there are opportunities to create value, economic and clinical and strategic, that matter to your executive, right? You know, turnaround time is interesting for them, but when you show them how they can reduce length of stay by a half day, now you're talking more of their language. And so you've got to go through an assessment process in a simplified way, be able to identify where the opportunities are. The second step is to really put together a meaningful strategy and something that is well thought out, takes into context the health system's objectives and the health system's environment, and aligns the lab's activities and value creation mission to support the health system. Because again, it's much more than turnaround time and cost per test. And so it's about aligning to some different metrics and then being able to operationalize that strategy. And that is the tough part for most people, and even most businesses, because you can have a lot of smart people saying, hey, here's what we should do, but getting the behavior change and the process change and the infrastructure change to make that happen is the real magic. And so for that, that's what we said earlier, is helping being able to convert the strategy into some sort of balanced scorecard. That balanced scorecard into some sort of business process that has a routine way of driving the tactics and the strategy, a routine way of assessing the data, and a routine way of enabling the organization to course correct. But at the end of it, being tooled in such a way, what I mean tooled is have the informatic tools available to you to be able to track, record your impact, and more specifically present back to the stakeholders that matter, whether it's the executive, a payer, or a patient, or a clinician, information that demonstrates how you helped them, how you are helping them, and then enables them to engage with how you can help them more. And those are all things that we've really rebuilt our organization around: assessment, strategic development, business process implementation, supported by the appropriate tooling to be able to communicate, engage with, and drive value through and for all the stakeholders.
Thank you, Jeremy. Now, before we wrap, Jeremy and Brian, do either of you have any final comments for our audience?
Brian, I'll let you go first.
Jeremy, Christy, thank you. Real quick, everyone, I do appreciate the opportunity to share how GC LabTech was able to incorporate some future state technology into its present day operations. Again, not to continue speaking about this point, but it is a fantastic tool that helps us move into the future. By no means do I want to prove the point that you're trying to reduce staff with this new technology, because it's not about reducing staff. It's really about better utilizing your staff, and this system allows us to do that. It's just one of the many ways that the future of healthcare and operations is upon us. And, Jeremy's right. The laboratory is a major driver in innovation. Unfortunately, we are just one of the backgrounds within much of the healthcare setting, because for so long, many laboratorians have been a silent partner within the healthcare system. And please use this opportunity to showcase the innovation within your labs, how you're able to do things better, even if it's not to showcase throughout your entire health system. Just look at the tools around you, find the way to show that value being added, and I promise you, your world will start to change. And really, it comes down to understanding how to communicate with those who control your world, the C-suites, the hospital leadership that are often not laboratorians. It's really about trying to find the best way to capture those opportunities to make yourself relevant. And so to emphasize Jeremy's point, the lab really is a great innovator, and it definitely has a strong role in the future of healthcare. So with that, thank you. I appreciate the time today, and again, look forward to another discussion soon.
And so just from my perspective, thanks, Brian, and from my perspective, just building off of Brian's points, I give you just two. The first thing is I want to affirm everybody on this call, that how important you are. And although that may not always be recognized, what's done every day in lab medicine is saving lives and is creating value in health systems beyond what anyone recognizes. And the role you have is extremely important, and it can't be overstated how important it is. The second point outside of affirmation is encouragement. I want to encourage you to really challenge yourselves, your thinking, your team, your institution, to reimagine the lab, to reimagine it not as a production facility, but reimagine it as a decision engine, as a quality engine, as a strategic engine. And for sure, it means it has to do different things. So we have to feel empowered and encouraged to actually build some new competencies to approach our business differently. And so I want to encourage you to really challenge yourself to the degree of uncomfortability about doing that, and about stepping out and working with clinicians and working with your executive and bringing them some meaningful help, because I promise you they will welcome it, and the research says that they will. And I also want to encourage you to reach out, at least to us. I will tell you, that there's a lot of manufacturers out there, but what we would want to provide or support you is in that process, not necessarily the equipment. For sure, that's important to us, but I want to encourage you to feel like you can reach out and say, hey, I'd like to have the profitability for my institution. We can get that for you. I'd like to have somebody help me with an assessment. We can do that for you. So don't hesitate to reach out and ask for those things, even if you don't do business with us, even if you have no intention to do business with us. Those are things we're glad to help out with. And so that's my last bit of encouragement. And the final thing is thank you. Thank you for your time, and thank you for your questions. And we wish you, all the best in being the catalyst of change for your health system.
And thank you, Jeremy and Brian, both for your time today and your important contribution into transforming healthcare into health creation. We'd also like to thank LabRoots and our sponsor, Abbott Diagnostics, for underwriting today's educational webcast. This webcast can be viewed on demand, and LabRoots will alert you via email when it's available for replay. We encourage you to share that email with your colleagues who may have missed today's live event. You will now be redirected to the registration page for Chapter 2, Redefining Lab Operational Excellence. Sign up now and you'll receive an email informing you of the next live broadcast. We hope to see you there. Have a great day.